Hello, everyone. Today we are talking about two big giants in the aesthetics industry, filler and Botox.
Yeah.
And so, kind of, we get a lot of questions about which is which. I feel like if you're new to aesthetics, it's obviously confusing.
Yeah.
I mean, if you have no background in this stuff, they're all just brand names mostly, and they're all just made up like medications. So, like,
Yeah.
if you just went to a pharmacy and picked random stuff out, I feel like it would be kind of the same.
Yeah.
So, the biggest difference between these two is what they do, how they work, and how long it lasts.
Yeah.
So, Liz, you could start with Botox a little bit.
Yeah. Well, first of all, it's really not your job to know any of this. I have a ton of patients. Don't be intimidated by the fact that you don't know what you need or what Botox or what filler or Dysport is, because most people don't.
Yeah.
So the biggest difference is, like Keller said, what we use them for and what they work. So Botox or Dysport or Xeomin or any of the neurotoxins out there, they work on the muscle. So they're injected into muscles to essentially paralyze them. So we do not want the muscles of the forehead contracting and creating those lines. So that's where we use Botox or Dysport or any of the neurotoxins again.
It's typically given in a syringe like this versus something like filler. Filler is going to be a lot bigger syringe, but the needle on this is also super tiny. So if you're afraid of needles, Botox is probably honestly the best. I don't even know if you can see it. It's so tiny.
Yeah.
But it's also it's a very small amount that gets injected. So this is only like 20 or so units.
Yeah. So neurotoxins come as a powder and they're diluted with saline. So there's been a lot of buzz on the internet lately about your injectors diluting your Botox. Yeah, they are. We have to. We can't just sprinkle the powder on you and it works. So neurotoxins are used in muscles that we can paralyze to diminish wrinkles. There are obviously some muscles on the face that create lines like smile lines. We can't paralyze these with Botox because then you won't be able to smile. So where the lines do get a little blurred is we do also treat lines with filler in some cases, but here in a little bit we'll talk about how those are different and how that works. But essentially think of neurotoxins as a muscle paralyzer. We'll use them most commonly in the upper face. A very tiny amount is injected.
It's also temporary is one of the biggest things.
It's temporary. It also doesn't work immediately. We have to wait about a full 2 weeks for it to kick in all the way. But it can also be used in the lower areas of the face. So we do it a lot in the neck, in the chin for a pebble chin. So it's also used medically for spasms, for migraines, things like that. So it has a lot of different uses, but the way it works and the way it functions, you can just think of it acts on the muscle and it stops muscle contraction.
And you'll need it about every 3 to 4 months.
Yes.
Now, filler is, like we said, in a much bigger syringe. This does not work on the muscles at all. So this is essentially just adding volume to an area.
So filler is a hyaluronic acid gel, or at least the fillers that we're talking about today are hyaluronic acid gels. So they go in. There's a ton of different fillers. Each brand of filler also has different consistencies. So there are fillers that are more stiff, or what we can discuss as a higher G prime, which is just nothing that you as a patient needs to know, but you may hear that word in aesthetics. But that just means it's stiffer. So it more likely is going deeper down on the bone to replace volume loss down deep in the face. And then we have some more fluid fillers that are a little bit softer. They move a little bit more with expression. And those are the ones, like we talked about earlier, that we put maybe to treat lines in areas of the face that neurotoxins can't treat. So like smile lines, or sometimes even acne scarring, or if we need a little bit in our more superficial area in our cheek and we need it to move and follow expressions more fluidly. So there's a lot of variations when it comes to fillers, but essentially we're adding volume with filler, and that's the main goal. We lose volume as we age. We lose volume in the bone. We lose volume in our superficial fat pads and our deep fat pads. And then we also, our skin itself just loses volume and loses its elasticity and its structure. And so we can go in and add that to any of those structures.
This also lasts a lot longer than any neurotoxin like Botox or Dysport or Xeomin. So typically patients, like in the fastest metabolizing patients, probably 6 months, but a lot can go 9 months or even a year. This is more kind of like when you think you need more, you can have some.
Yeah.
You're not going to notice, like with Botox, when your muscles, like the function is starting to kind of come back and you're starting to kind of crease that skin again. Filler doesn't really work like that.
Yeah.
And also a big thing patients always kind of think about is getting overfilled with filler. And so that's one, great way to avoid that is by not getting it done, like clockwork every 3 months. That's just too soon most of the time.
And often what I'll suggest in patients is usually if we're correcting and we're treating filler, revolumizing for anti-aging purposes, it may take several syringes in the beginning. But then I just suggest yearly coming in, let's look at you, let me see where we've lost a little bit of that volume and where we need to touch up. But typically if we maintain that and do just yearly check-ins, if you're the average patient, then we can just keep you at your baseline, your new baseline, a little bit easier with less syringes. And it's not your job to know when you need more. You can just come in and we'll talk about it. But we'll also show you here in a minute when we demonstrate the different consistencies of filler and neurotoxins, how much is actually in one syringe. Yeah. Because sometimes when patients come in and I'm like, you're going to need 3-4 syringes at least to correct, whatever problem we're addressing.
It's only this much.
Yeah. They feel like, oh my gosh, that sounds like a lot, but it's really not. So we'll show you that as well.
So sometimes when we talk about, especially in lips, if we're talking about, a lot of times I'll ask, do you want a full syringe or a half syringe or do you know? And some patients do know, some don't. It's totally okay. But this is what we mean, like a full syringe. This is a full syringe. So half would be half that, of course.
It's 1 milliliter.
Yeah. So it's really not much at all, even if you use the whole thing. So that's why it's really important to have an injector that you can trust and also that and that you also share the same vision with. Like you want to make sure that their style is similar to yours because you can do a lot of stuff with filler. So you want to make sure that you...
Yeah, there's a medical aspect to it, of course, and that's the number one important thing is safety. But there's also an art to it. And although we talk a lot about it takes a lot of filler to look overdone, however, if you don't use it correctly, you can either take a little bit of filler and look overdone, or you can take a lot of filler and look look very well done. So it's about injector and technique. If you're putting the filler in the right plane, in the right locations, we get a pretty result with, whatever amount we choose. It's just how much can we do and how much correction we can get. Whereas if you're putting it in the wrong plane or choosing the wrong filler, or putting it in the wrong location, you can very quickly look worse or look overdone even with a small amount. So you just have to find somebody you trust. And if your visions align, like you mentioned, then you can often get a very good result, whether that be with a little bit or a lot of filler.
Okay. So like she said, Botox or Xeomin or Dysport or whatever neurotoxin you're choosing comes as a powder and it's reconstituted with saline. So, the consistency is basically a liquid.
Water, yeah.
So,
like you can see,
if you probably
can't even see that,
very
but
small.
It drops off just like water, little water droplets, because it's literally just a powder dissolved in saline. So, again, it is diluted. We can play with the dilutions. There's a lot of different things injectors can do to tailor it to you, and it looks different for everybody. So, give me that needle, please. So with filler, we of course inject it with a needle, and the consistency is much different. So I'll show you here on the back of my hand, and you'll be able to see it kind of stick to itself and mound up. This is a little bit more of a structured filler, that higher G prime that we talked about. So you can see it kind of builds up and holds its structure. And so you'll see here, this is one whole syringe. So can this make a big difference in the right area? Absolutely. But when you look at it, it's really not a huge amount of volume. So if you think of this times 4 to do like facial balancing, It's really not a ton. You know, you're not going to look overdone with this if it's done correctly. So, but it will make a big difference done correctly. And you can just kind of see it. It's bouncy. It's fluid. It also moves, but it kind of it sticks to itself, and you can see how that would add volume. So much different than essentially
Water.
Water. Yeah. And I mean it. You can see it's kind of like a
There it went.
little ball.
If you have any other questions about how it works, how to use it, what areas it can be used on, we're always more than happy to have that conversation with you, whether it's over the phone or the best way is to come in person for a consultation. That way we can, you know, assess your muscles, how they move, and kind of your unique anatomy, because it is important when you're talking about injecting anything. Everyone's different. So
yeah, and I want my patients to feel educated and feel empowered to make their own decisions. But I also don't want you to feel stressed in thinking that you need to know all of the differences.
Yeah, if you want to learn, we're more than happy to teach you. But we have some patients like, I don't care. I don't care. Just do it, and we'll be good to go. And that works for us too. So
yeah. So well, we hope you learned something.
Yeah.